So when we talk about the difference between relapsing and progressive MS, we have to consider the different compartments of the brain involved in the disease. In relapsing remitting MS, the disease is driven by a peripheral immune system that enters the central nervous system through the open blood-brain barrier and forms new lesions. So the lesions in the white matter are highly inflammatory and actively demyelinating. When the disease gets progressive, nature of these lesions change. They are not driven anymore by the peripheral immune system. We talk about the so-called compartmentalized inflammation at that disease stage where the blood-brain barrier is closed, and behind the intact blood-brain barrier, the lesions are still inflammatory. However, the inflammation changes more from the adaptive immune system that drives the relapsing remitting disease stage towards the innate immune system, and here especially the microglial cells in the central nervous system that drive lesion formation in the white matter in the progressive disease stage. In addition, not only the white matter but also the gray matter is being demyelinated in multiple sclerosis, and with increasing disease duration and especially in the progressive disease stage, gray matter demyelination dominates the picture. So we have extensive gray matter demyelination within the cortex, but also within the deep gray matter. And the third point that differentiates relapsing remitting MS from progressive MS is that the disease process gets completely diffuse in the progressive disease stage. It's not restricted anymore to focal lesions in the white and gray matter. There's diffuse inflammation also in areas that we earlier described as normal appearing gray or white matter, but nowadays we probably have to talk more about a diffusely damaged brain tissue in multiple sclerosis. So MS becomes a global brain disease when the disease gets progressive. Within these inflammatory lesions, we do not only see demyelination, but we also see damage to neuronal and axonal structures, and this damage accumulates over time and gets prominent in the progressive disease stage, and this extensive so-called neurodegeneration may also be a cause for the disease progression in multiple sclerosis. And this is associated with only limited repair within the lesions that we see in progressive disease stages. Whereas in relapsing remitting MS, we see extensive remyelinations or formation of new myelin. This is extremely limited in the progressive disease stage. So all these different features of the lesions and of the diffuse damage in the brain contribute to disease progression and makes a difference between progressive and relapsing remitting MS.